me that's only gonna waste some time. But this whole time I've been telling my VA practitioners, UNM practitioners, there's something wrong, and this neurosurgeon got it, and it's a rare disorder, and now I'm trying to get some help in operating on this disorder that's been causing me a lot of issues, and I just turned 41, and my quality of life is decreasing, and I think because it takes a warrior to get through the system, you know, because I get up, I shower, I show up. That, there's a perception now on the inside of everything's okay, and it's not. So I appreciate your help, and I appreciate you listening, and thank you.
And we can work on this one too? All right, we're going to work on that. Okay, good. And we do. We feel terrible, and I appreciate your courage to talk about your personal issues.
Just listen to the patients, and especially, it was three female practitioners. This was at least 3 to 4 years ago now. That one literally told me, "Why would you want to be in a club that you don't belong?" What are you talking about? I had a breast tumor, and no one can tell me that's not cancer. No one can tell me that. It was causing me symptoms. And so I pushed, and I got it. Sure enough, I was fine, thank goodness. But I had these surgeons and practitioners not wanting to biopsy me when it was my choice to have those answers I wanted on the microscope. No probabilities of imaging. I gave them permission to to do a needle biopsy. They would not do it. So I had to push them to get the whole thing in. So I know it's very personal, but I think this is important for you to know.
It just tells us communicating with patients needs to improve, and we do appreciate you. And I'm going to just take a couple more up. I asked them to only stay an hour so that folks could, if they were concerned, because you're terrifying, the two of you, that people would feel, but it didn't seem like anybody was intimidated, and they could have left. And I want to thank them. They stayed well beyond when they were supposed to. They are very responsive to our office, and typically when I'm adversarial on behalf of a community, that's not good. And everyone has really worked hard to get along with our office and to hear us and to take our work seriously. So I thank you for that and your respect of the veterans in this community. I did not highlight the incredible hardworking and professional interpreters. That is hard work, and I thank you very much. I also want to give a shout out to the officers who are here, and I really appreciate your service to our community and to making sure that we have a safe, productive environment in which to share our concerns, our passions, and our ideas. That's the way it ought to work. And I really, did you have something you wanted to say?
I know if VA physicians are allowed to fill out the paperwork for medical marijuana cards. I know that was happening.
Yeah, they are not yet. I'm for that. I advocated for New Mexico to have a medical marijuana or cannabis program. I'd like to have it available for vets through prescriptions at the VA, not just through the state program. I would say in this administration, we're going to have a tough time because currently, and I disagree, but the Attorney General is saying that he actually wants to crack down on states who are using medical marijuana and because it's against federal law, and states have ignored that law because it's good, I think it's good patient care. We're going to fight that, and I would guess, I can't speak for, and I won't make him do it, but I would guess that many VA administrators and many VA physicians, and primarily many VA behavioral health practitioners would like to have access to botanical drugs with fewer side effects that could have a productive impact, and would like to be part of that opportunity if they think it's medically warranted and have a relationship with the patient. They're not in a position to do that unless there is clear authority, and I don't think we're going to win that anytime soon in Congress. I have to be honest about it. So it's going to have to happen for vets at the state level, and we're going to keep making sure New Mexico offers that, and we're going to fight against a federal administration that would take that away.
One more?
Yes, ma'am.
And again, this is medical. There's a tremendous problem trying to get non-formulary drugs through, to get the purchase going through, specifically the pain clinic. Lyrica is the primary one that keeps coming up. and it's being prescribed by the physicians, but since it is very expensive, it's taking weeks, literally weeks, to try to get the prescriptions filled.
Yes, ma'am, we do have a non-formulary process, but where we can get those through. Joe is here, and he'll get with you, and we'll get some more information specifically, and we'll give you a call back on that, and make sure that we close the loop with you.
It's moving faster. I know, and I'm actually struggling with pharmacy benefits work and formularies, and we make it really hard. Again, I really do want to blame them, because it would be so much easier. But we created systems that were intended to save money, and I think they're ineffective. And I actually think we should stop advertising drugs so that we don't have the over-prescribing because patients, it's easy to get that in your head. And we've become immune, I think, don't you? That you have this laundry list of serious life-threatening issues and we ignore them. I think I want that drug. And so we need to do something about that, but it's so hard to get access to the right care at the right time, at the right place, and that just makes Americans sicker.
And this is coming from a terminally ill patient.
Yeah, that's not right. Is there a way when you've got a terminally ill issue to move things faster? Is there an expedited process for that?
We have to look at every single case, and so generally we do have fewer hoops to jump through in those cases. But each case we have to look at each one of its own facts.
Let's get that one done.
One more question again on medical marijuana. If a patient is in the P clinic and they're doing their UAs, if they test positive for marijuana, are they going to enter trouble?
We have to follow the federal regulations on that.
So the answer is, yeah, potentially. It's a really difficult issue, so that we need folks sort of in a dual system. You should work with my office. We don't want anyone penalized, and I'm a big believer personally that, again, patients and their provider should be able to make the best possible decisions for that patient. They shouldn't be hampered by rules that just don't seem to me to make any common sense whatsoever. Thank you. All right, thank you, everyone. I really appreciate you.